As we mentioned earlier in the show, we are celebrating Hispanic Heritage Month here at 9 News.
And our health expert, Dr. Coley, is here now to talk about health issues that impact the community. So what should Hispanics know about heart disease and what's similar and what's different when it comes to that specific demographic?
So as a cardiologist, I see Hispanics in my office all the time. And one thing that's similar, number one killer, men and women. So Hispanic men and women most likely to die from heart disease. But their heart disease looks a little different. It comes on earlier and it's a little more aggressive. They have more risk factors for heart disease. Now you guys can imagine what those risk factors might be: high blood pressure, obesity, and diabetes. So it is a little different in that community.
Why is it more common in this community?
It's a combination of their genetics, their environmental factors, and their access to care. So people often say systemic racism is a huge problem. Tell me a little bit about what your kind of classic thought is of a Hispanic person. What does their life look like? They're spending time outdoors. They're spending time in food deserts. They don't have access to care. We don't have a lot of education in many languages. So many of the materials that we give them are written in English, which means they don't necessarily understand them. And we know that in Hispanic women, especially, heart disease is underdiagnosed and underdetected and undertreated. And these women do worse with pregnancies because of these genetic factors. So they have genetic mutations that give them diabetes earlier. Where do Hispanics hold on to their fat? On their waist. So their fat distribution tends to be different. And then you add in the fact, like I said, food deserts, lack of exercise, lack of leisure time. All of that leads to more aggressive, earlier heart disease.
Because you said that it's just disproportionate when it comes to the barriers and the access to care, are you seeing in the medical community that they are trying to right this wrong? Is there any initiatives in place to help end this systemic racism, so to speak, that's inside the medical industry?
Well, one of the things that we've recognized is that the risk prediction tools that we use don't work for different races because they were designed in the Caucasian population. So predicting risk in a Hispanic individual for me as a cardiologist is a huge challenge because I'm applying basically what was developed and validated in Caucasians to Hispanics. Another problem that we have, we aggregate every type of Hispanic into the same type. So it's like saying every Asian is the same. Southeast Asian versus East Asian, they're all different. Their biology is different, their genetics are different. So a Puerto Rican is not the same as a Central American, as a Mexican. So we really need to start systematically disaggregating a lot of the Hispanics so that we can start to identify sort of individual ways that we can predict risk. And so what we end up doing is we underscreen, we underdiagnose, and we undertreat. Now there's still a phenomenon called a Hispanic paradox, which is that even though they get disease earlier, they get more aggressive disease, they do better with that disease. And a large part of that is their family and their community. So kudos to that, because that family model really helps them to sort of manage the diseases better than the Caucasians that would get that same sort of disease.
Well, it sounds like research is kind of at the heart of how we can improve and make this better. And then you think about federal funding being lost and grants are, going by the wayside. Where would you even begin? What does this look like?
So I think the first thing that needs to happen, which has not happened to date, is that when you look at a clinical trial, you need to have representation of the Hispanic population. You need to have representation of the Black population, the South Asian population, the East Asian population. You need to break that out, and we need to understand what the differences are. And I think that's what really needs to happen, where we're selecting Hispanic patients, which means materials in Spanish, which means a higher level of health literacy for educators. Even for me as a physician, explaining preventive health in Spanish is a lot harder. So I need to have access to resources that allow me to do that so that I don't just say, okay, I'm less likely to do it just because I don't speak Spanish.
Very interesting. Dr. Coley, as always, thank you.